we are recording.
Okay.
Tell me who you are and tell me a little bit about your business.
Okay. My name is Alexandra Schneider, and I own Ava Clara Couture Bridal. And basically what we do is we sell wedding gowns locally in Virginia Beach area, Virginia, and we also sell bridesmaid parties. So we outfit pretty much the bridal attire.
And how long have you been doing it?
2.5 years been in business with this store. I've actually been in business with the bridal industry for about 5 years now.
Okay, all right, good. Tell me real quick, you get health insurance through your husband. Can you talk just a little bit about sort of how you handle your healthcare needs?
Right. Initially, I was getting my healthcare through my husband's company. Then he ended up coming and working on board with us, and so now in turn, I had to go out and find my own, and I've been paying a lot a month for being a 28-year-old female who has not had any past injuries or anything that would qualify as a pre-existing condition. I've run into several problems with our health care, whether it be me being turned down because my father passed away a few years ago and I went to therapy for that, and then they came back and said, no, we can't accept you because this is a pre-existing condition. Those are things that I find that are very upsetting and unfortunate in our society today, that you're persisted to go and get help mentally for those things, whether it be mentally or physically, but then in turn you end up getting sort of wronged at the end of it. That if the healthcare ends up saying, no, we don't want you, you seem to be damaged, and then, or you get an insurance agency that wants to jack your rates up, and you don't really have any other options. And being in this country, and especially in my business, you know, there's no monopoly. Okay, that's not what the American way is about. A little competition's not bad, and I don't find that in our healthcare.
You don't find that there is competition? No,
I find that they're very much. If one says no, then they all say no, or one has got it where they can jack it up, and they know that they can do that.
All right.
So I don't find it fair or balanced at all.
All right. So. Have you tried, you're getting health insurance as an individual now?
As an individual,
Did you look at trying to get it for the business?
We did, and that was interesting too, because we were a younger business, and because there weren't full employees, it was just my partner and I. It was almost double than what paying for individuals, and that's another problem we're running into. And now my partner was getting it through her husband. They're unfortunately going through a divorce, and she's having to go out and get on her own. And we were going to revisit it again for the business, but it's such a challenge. I understand that things take their process, but it then comes it was almost like $1,000 a month for the two of us, which was just absurd. And we're very healthy individuals. So.
All right.
Yeah.
Two more questions. One, because this is designed for the legislature, if the governor or your state senator walked into the shop here, Alex, and said, what should we do about health care? What would you tell them? What advice do you have for the leaders of Virginia?
I know that it's it seems difficult. I know that people will say, well, you know, Canada or the Europeans, they can operate on this sort of infrastructure. I know that doesn't always apply to everything like the American way, but I do find that there should be some medium ground. There should be something that we're not paying this much for things that we ultimately end up, if we are in the ER, we're paying so much money and we're not covered for it. Why even have it? Why even make us, on a state level, have to have these sort of insurances, whether it's automobile or need this, and penalize us when, you know, we're here and we're tax-giving citizens. So if the legislature walked in, I would say, what can we do, for a small business like ourselves that are trying to start up and try to bring, you know, for example, jobs to other people when we can start doing, but I can barely do that because I can't hardly afford my health care.
Right.
What can we do to alleviate that?
All right.
Yeah.
All right. Wonderful. Thank you.